Hey y'all, I am here to discuss a topic about how to explain what contrast is to pediatric patients. However, it's more about like the verbiage that I realize that I have to change, the language that I'm using for kids, and I think I have to transition that from what I say to adults as well, because I get so used to this repetitive like kind of saying that you give, right? Because there's instructions and there's explanations. So I've been working in CT for a decade now, so like just explaining it kind of, it gets like autopilot explaining it. And I like to tell them that there's a medication we have to give them, that it's contrast, that it's kind of like a tint or a highlighter. It's something to make your vessels and organs glow, stuff like that, right? But the main thing is, initially I would tell them that it's a medication, it's a medicine. And this is something that we don't want to tell our pediatric patients because kids don't like medicine. I mean, even adults, we don't like medicine. So like if you're telling a kid that's going to experience something so new, you don't want to scare them off. Of course, you want to explain everything to them from beginning to end, even before they get in the room, so they don't feel like, so they know what's going on. It's pretty much just simple communication with any of your patients, adults or children. You want to kind of tell them like what's going on initially. So for like pediatric patients, I like to tell them that it's a donut. They're gonna go on this machine that looks like a donut. They're gonna lay down, and it's gonna take a few minutes. And this is the part where if they have to have contrast, we tell them that it's liquid. So we tell them, because they already have trauma from getting the IV, right? Hopefully you don't have to put the IV in, because that's even more traumatic. But let's say the patient comes in with an IV. So you tell them that you're going to put it through that straw, and that it's a liquid. So that's the verbiage that I wanted to share, that I want to train myself to start using even for adults. I want to say that it's a liquid. And of course, when there's an injector, like you'll show them, this is the liquid. It's this water that we're going to give you. You show them that this is going to go into the straw. And that's it, right? It's going to highlight them. And then, of course, you're going to tell them and be honest that this liquid, when it goes in, it might make your body feel warm and fuzzy. You might feel, but you're not, but you might feel that you're going to pee, but you won't. Because some of them are going to be scared because they don't want to pee their pants. They always get forced, or not forced, but they always get reminded to use the potty before you go to sleep, or use the potty before they get in the car or when they go somewhere. So they don't want to pee themselves, right? It's embarrassing for anybody. So I specifically show them, point to them that this is going to go inside and that it's a liquid. It's a liquid. You don't say that it's not medicine. You just don't omit that completely. And then what I like to do is I like to ask them, do you remember how this liquid is going to make you feel? And then hopefully they will repeat what you said. And a lot of them will repeat it and remember. They're like, and then I congratulate them, like, yes, you did it. You were paying attention. So yes, it's going to make you feel warm. It's going to make you da-da-da-da. And let me pause this real quick until they figure out this car. And what else? So yeah, just have them repeat what they have to do. Like I'll ask them, so what's your job? I tell them initially that, hey, so your job, the only thing you have to do is to hold still like a statue. And you got to make it like a game kind of. So they hold still, ask them what's going to happen, and if they can repeat it to you, then that's great. Then they know what they're doing, they understand, because sometimes you can keep saying stuff and they don't understand and process it. But if you make it a dialogue and communicate, then I think it's more helpful And then you know that they understand. And if they don't understand, or if they have any questions, then that's when you ask them. But it's great to get that reassurance because you're on the same page. And of course, when the liquid is being injected, you're in there while it's happening and you're processing it through, because normally it's a routine study, so you have time to be in there with them and then ask them when they start feeling warm. And they should be able to tell you and be like, see, sometimes I'll be like, I got a magic trick for you. Watch, this liquid is gonna make you feel warm. And then like, it's all this magic stuff, right? Like this one kid, I told the kid that I got a few magic tricks for you. And I'm like, I have a liquid that's gonna go in and it's gonna make you feel warm. And then so once it happens, I'll do a countdown, because there's a timing that you have to see. If you notice where your timing injection is, I'll make another video about this, but it's around like, you'll do the countdown. It's around 40 seconds. Once it gets to 40 seconds, they'll start feeling warm. And you're like, see, you're gonna feel it in 5, 4, 3, 2, 1, and they start feeling it, and they're like, yeah, and then it's like you process it through them, and then you're like, okay, that's a normal feeling. And then you get out and whatever. And then some places, some facilities have those doors that have a button, so when you press a button, it'll open up. I like to have them stand by the door, and I'll tell them to say abracadabra, say abracadabra to the door, and then I'll press on the button and it'll open up and you'll see their face light up. It's so adorable. So yeah, those are some tricks. Just kind of make it fun and memorable for them and not so traumatic. But that's kind of how I get through my pediatric patients, try to explain those things. I hope that some of the stuff that I'm sharing is helpful to y'all, and maybe you'll take some things and use it into your practice as well. I'm not saying it's the right way. I'm just sharing that this is what I do and what has helped me and what I need to do to grow as a tech and to be a better tech for my patients, young or old. So stay rad. And it's actually Medical Imaging Week, so happy Medical Imaging Week. Toodles noodles, stay rad-tastic.